I'm probably going to start laughing because this is like take 3 that I have been doing. First, something popped up on my screen and messed it up, and then I ran out of space, so I had to delete some things. So, okay, maybe I can do this without being interrupted. The reason I am back, I know I said I'd be back soon, but you probably were not expecting me to be back in less than 24 hours. First of all, I've been posting some videos for people just to follow the process of my precancerous and basal cell and squamous cell cancer, and I'm currently towards the end of my morning and night treatment of chemo cream Fluorocell. And so I only have Monday and half of Tuesday to do, and then I'll be all done. So I have been, sharing this story with people online, and my last video, which was yesterday, has received a lot of views, and there's been also a lot of questions. So I kind of wanted to help with those questions, and I feel it's really important because people are confused on what it should look like, how they know. Oh my gosh, now there's a bird hitting the window. Anyways, on what it looks like, and sorry. Okay, what it should look like. I'm now getting the giggles. And and how it should feel, when should they go to the doctor, and how do you know if it's cancer or precancer. If it feels different to you, you should check your skin regularly. And if it feels different to you, or there's been some change, and you have that funny feeling that something's not right, then it's probably not right. And there's no harm in just going to the doctor and having it checked. So that is my recommendation. Also, you can do research on your own. Though, if you would Google or do research on basal cell or squamous, you would see the images and you would think, oh my gosh, I do not have that. And if I had those ugly looking sores, then definitely I would go to the doctor. And it looks different, I think, on different people. And at the early stages, especially the precancerous stage, it is basically just a red dot or a pimple or a sore. It doesn't want to heal, something that's prickly, it's itchy. It's just something that has creeped up and is not going away and is different. So that's the reason why you need to check your skin daily. So we're going to do something together. Oh my gosh, I'm getting blurry. We need to do something together. I am going to check my body online so you guys can see, and I can show you, hopefully you can see what I'm looking for. So hopefully this will clear up the confusion. As you see on my chest, it is very blotchy. If I came in closer, you may not be able to see online. There's lots of red blotchiness and uneven skin tone. I'm getting more freckles. So definitely right there is a sign of skin damage. So for example, I have never tanned my hiney, my butt. And if you saw it, it is as white as can be, like baby skin, and there's no freckles, and it's kind of pretty. But if you look at my other areas of my body where I've tanned, it is now ugly because it has tons of age spots and freckling or freckles and red spots. So sun damage can make you look beautiful or ugly when you get older, but you look awfully pretty when you're younger and tan. So I'm messing a lot on this video, so I really don't want to take a take 4, so just bear with me. Okay, so I'm going to zoom in so you can see, and I'm going to show you. You can see it. There is a red spot, and I have circled it. And before, it was kind of raised a little bit, kind of like a pimple, and it was sore. It just kind of like with my clothes, rubbed it, it was irritated. So I was convinced it was basal cell, and it made me go to the doctor. So I went to the doctor, and she did a biopsy on it, and to my surprise, it came back as precancerous. It was not basal cell yet, though if I left it go, I'm sure it would turn into basal cell. So I need to treat that. And if you look closely, I have lots of other red spots. And I'm sure those are precancerous. I do have an area, there's a scar here, and you go to the right of it, and the skin is kind of lighter and kind of white. I did, a little over a year ago, had a biopsy there, and it came back basal cell. And right now you really can't see anything, so the biopsy kind of helped it but the cancer cells are still there. So I actually need to have another surgery or use a chemo cream to get rid of that. But really, you don't see anything, do you? But it's there. Also, I have a scar. Let me find it right here. And at the very top of it, I feel where it's crusty, like scabby and flaky. I don't know if you can see that. So if I went to the doctor and they were examining me, they probably wouldn't see that because they're not going to be looking and feeling me like that. So I would need to bring that to the doctor's attention and kind of have her look at it, and then she would decide whether it needs to be biopsied or not, because my squamous was just a dry, patchy area like that. So that's the reason why I get all freaky now when I feel something dry and flaky. I also get these little skin tags, not skin tags, it's kind of weird to explain. If I'm feeling over my skin, it'll feel like a hard piece of skin that grows, and it comes on quickly, and then it drives me crazy because it's there and I want to pick at it. And I'm telling you, when you pick at it, it is severe pain. It's pain. It doesn't last very long, but it's oh my gosh, it's so bad when you pick at it. And I told the doctor that, and she says, well, don't pick at it. That was the answer. So I'm not for sure what that is. I think it's just a reaction to the damaged skin, the skin damage from being out in the sun too much. So those are not fun, and I guess I need to stop picking at them. But I am going to show you what I have found, if I can remember. Oh, right there on my arm, if you can see it, I kind of circled it, is another red dot. I would assume that is precancerous. And then I'm also going to go to my leg, and I will show you that. Oh my gosh, I have not shaved. Thank goodness I have blonde hair, because this is embarrassing. Okay, so I'm going to show you that they are kind of a little dry and patchy, but I have really dry skin right now because I haven't put lotion on, so I apologize. And but there are two. I'm going to show you two. I don't know if you can see. Oh Jesus, this is hard. Let me stand up. This is very difficult. Okay, right there. See there? It looks like two pimples. I mean, gosh, I need to take lessons on trying to videotape myself. But anyways, there's two. The top one kind of feels like a pimple, and the bottom one feels more like a dry, patchy area. So when I go back in 3 months, I need to show her that. So you just kind of want to go through your body and look for any kind of red sores or little crusty areas or little pimples. And usually if they're tender or prickly or have a little pain to it or gets a little more raw and irritated, that would be, I would say, basal cell. If it's more just a red area that kind of doesn't have any pain to it, it's just red, then it's probably precancerous. So that's the best I can tell you, but everyone's probably different. So I would just go through and check. Also, if you have any moles, you want to keep an eye on those, especially I think with people who do have skin damage or sun damage, or have issues with cancers on the skin, that you have to be really careful of the melanoma, because those are the ones that are extremely serious and can spread quickly, and the chances of survival is a lot less, where the basal cell and squamous is highly treatable. So if you have any moles, you want to keep an eye on it. So what I do is first of all, I have the doctor look at them, and they're like, oh no, that's fine. And I'm like, really? Because I'm like picking them out, saying, well, if I divide it in half, the other half of the mole looks different from the other half, because that's what you're supposed to do. If a mole grows in size, or if there's changes to the mole, or if the mole has different colorations, like usually they're browns, if you have dark brown, light brown, reddish brown, different colors in it, that's not good. Or if you divide a line in it and one half is a little smaller and the other half is like they're not equal, there's a difference in the outline of it. I know it's kind of hard to explain. Then that's bad too. So of course I'm going on my moles and checking all that. And I'm like, oh, they're like, oh no, you're being too picky. You know, they said, no, they're fine. So what I do is just take a photo, and then that way I know if they changed, I can look back at those photos. So I I would recommend that. I guess that's all I have to say. Sorry, it was a horrible video and I lost my train of thought and I got the giggles, but I appreciate you checking in. And again, if you have any questions, just ask me and I will try to help, or at least give you the phone number of where I go, because I'm really pleased with where I am going. So I'll try to help you. I will talk to you soon, and I'm going to go treat my face now. Bye.